to the Everyday Therapist. I'm Dr. Deb, and this is my channel where we talk about all sorts of things having to do with psychology and clinical issues and research as well. So, we have been talking a lot about trauma, and I'm going to continue on this particular topic for a while because there's a lot to it. And there are quite a few therapists these days who are of the opinion that many of the mental health issues we see coming into clinics and private practices really have to do with trauma. It can be a combination of individual trauma, or it can be familial trauma, generational trauma. All of these things can result in mental health problems. So, in the last session, we talked about some personality disorders that are potentially related to trauma. Now, today I'm going to focus on dissociative disorders, which are definitely considered trauma related, especially if you look into the Diagnostic and Statistical Manual, you'll see in the DSM that dissociative problems are listed as trauma related. So, what does dissociation mean? Well, what it means is being away from one's self. Uh, there are several different versions of it. Uh, 20% of the population in the US have had dissociative moments. In terms of being a chronic problem, it's about 2%. But many people have had this sort of sense of being in a situation and not really being there, sort of pulled away. A good example would be if, say, someone is in an auto accident and is suffering a bit of shock, and the person sort of feels like something is happening. I'm watching it from the outside. I'm not really there. That is called derealization. The what you are seeing doesn't seem real to you. Another version is called depersonalization. That is when the person feels like he or she is out of her body, out of his or her body, and observing. So, for example, I had a client once who, when she was very young, uh, was left in the charge of her older male cousins. They were supposed to be babysitting her. Rather than instead of babysitting her, what they did was sexually abuse her. And she reported to me that she felt when the situation happened that she was sort of sitting on a piece of furniture watching what was happening. That's depersonalization, just sort of an out of the body experience. Now, one another kind of dissociation has to do with amnesia, dissociative amnesia. That's a situation where a person has been in a very traumatic or stressful situation, and in order to protect the brain, well, protect the person's psyche, the brain will make the person kind of black out while the person is traveling. And so the person may uh, find him or herself in a place that the person doesn't even recognize. For example, I once had somebody with whom I was working call me up and say, I don't know where I am. Uh, Please help me find out where I am. Luckily, my phone number was on speed dial, so the person could contact me. So the person realized that he was in a hotel room. So I suggested looking around to find the phone book, calling down to the office, just so that the person could figure out where he was. Once he was able to do that, he was able to contact other people and tell them how to find him so he could get back where he was supposed to be. Now, that doesn't happen very often, but it can occur. Uh, Another type of something that also is related to amnesia, dissociative amnesia, is called the fugue state. That is when a person kind of loses sense of who that the person is. Sort of like, uh, who am I? Um, and I've seen that happen too. I've had somebody call me up and say, I don't know who I am. Who am I? And so there's discussion with me telling the person who that person is and what to do in the situation because of lack of self knowledge. So that can occur too. Now, the most profound version of dissociative behavior is what's called dissociative identity disorder. And that occurs when a person usually has had multiple traumas, usually of various kinds, starting at a very, very young age. I have worked with some clients who've had DID, dissociative identity disorder, and they all started having many traumas before the age of about 3. Some of the traumas they could remember initially, some of them came back through various uh, therapies. But what happens in those sorts of cases is that during the traumatic situation, the child will, in order to mentally protect itself, will break off sort of a piece of it. And that's called an alter. Alters will take over parts of the identity of the person and protect the person, basically. And these pieces will stay with the individual throughout the individual's life unless the individual begins to realize that something is going on. For example, I once worked with somebody who didn't know she had DID. Uh, she knew something weird was going on. She kept finding drinks that of coffee drinks and things like that that she hated in her refrigerator. She also was telling friends that she was pregnant, although she was infertile. So uh, there was something going on, and she didn't realize what was going on. And so conversations with other clinicians and so forth, we all agreed that, and given her past traumatic history, that DID was probably the situation. And I had her do a screening test for that, and she scored really high on it. And when I explained what it was, it made a whole lot of sense to her. Uh, and so she was beginning to go on her journey to explore and try to reintegrate herself. Now, other people who have DID, um, they don't want to integrate. They like having different slices of themselves do different things throughout their lives. Uh, so, for example, one piece might be really good at working with children. Another one might be a really good cook. And so somebody like that may decide not to um, integrate back. But these this splintering off is due to really intense clinical issues, repetitive research as well. Traumas. So we have been talking a lot about trauma, but I'm trying to keep it short. I'm going to continue in the future of this particular topic for a while. We can talk about it because there's a lot to it, and there are quite a few therapists as a whole these days, who are of the opinion that many have of the mental health issues, various clinical situations, that percentage goes up. Practices, and especially in, say, substance abuse, it can be a combination of facilities, individual trauma, 10%, or if not higher. Familial trauma, generational trauma. In my experience, all of the majority of people who can result in such facilities have had extremely traumatic in the last childhood session. We talked about some personality disorders that the DID are potentially related to trauma. And the substances also I'm going to focus on and dissociative future. I will be discussing are definitely relationship of trauma substance abuse, especially if you look into but that's for future diagnostic and statistical manual. If somebody has DSM, that dissociative identity problem or any other listed as trauma related problems. So there are a bunch of other things that go with it. Well, for example, what it means is eating disorders. There might be from a part of the person and alter. There are several different versions of it. Eating and not 20% of the population, a lot in the U.S. has had ideation and attempts. In terms of being a chronic problem, it's about 2%. There might be sleep problems. The person might have many people have had this sort of sense of relationship in a situation and not really being there. Sort of older types of traumas that occur. A good example would be if, say, neglect and things like that is in the person an auto accident and suffering a bit of shock. The person sort of feels like something is happening. I'm watching it from the outside. Before, I'm not really there. Dissociative problem. That is called there might be a lot of self-harm as well. What you are seeing doesn't seem real. I will say I've seen all of these things. Another version is called depersonalization. I've worked. That is when the person feels like
somatic symptoms.
he or she is
Out of her
somebody has a
body,
set
out
of
of somatic
body,
symptoms. They think they are
and
sick
or
or
something
something.
will hurt.
So, for
but
example,
there's nothing
I had
really
a client
wrong.
once, and
Who, when
again,
she was
it's
very,
sort
very
of
young,
the body
was left in
remembering
the charge
what
of
happened.
her older
So the
male
person might
cousins.
get a lot of
They were
stomach
supposed to be
aches
babysitting her.
when in
Rather
certain
than
situations.
Instead of babysitting,
And
her,
obviously,
what they did was
there's
sexually
going to be a
abuse her.
tendency towards
And she reported to
anxiety
me that she felt when
person will
the
always
situation
do
happened, that she was
some
sort
of
of
the alters
sitting
may
on a
be
piece of
very
furniture,
uptight and
watching
tense
what
about
was happening.
situations. That's
And there
the
will be a lot of
realization
depression
because a
and
lot of
out of the
times
body experience.
people who are going through these
Now,
sorts of problems don't understand
one
why, and it just scares
another
them
kind of
and makes
dissociation
them
has
sad.
to do
They
with
feel different
amnesia,
from other people.
dissociative amnesia.
So
That's a
as I said,
situation
I've
where
seen
a
all
person
of
has
those
been in a very traumatic
people I've worked
or
with who
stressful
have
situation,
identity
and
disorder problems.
in order to protect
Now,
the brain, well, protect the person's
what
psyche,
I've been talking
the
about
brain will
in terms of
make
trauma,
the person
I haven't
kind of
even
black
talked
out
about
while the person is
post-traumatic
traveling.
stress disorder.
And so the person may,
And I'm going to say that
find
the
him or
next
herself
one,
in a
just
place
because that's the
that
one everybody hears
the person
about.
doesn't even
And
recognize.
for example,
I
it
once had
overlays
somebody
a lot of these
with whom I
other
was working
versions
call
of
me up and
trauma
say,
or trauma
I don't know where
responses.
I am.
So
Uh, please help me
as
find
I
out
always
where
do,
I am.
I try to give
Luckily,
you something
my phone
to
number was on speed dial,
use
so
for
the person could contact
relaxation.
me.
And so we're going to talk about
So
the
the person
vagus
realized
nerve.
that
Actually, there are
he
two
was
of them.
in
One on the left side,
a hotel
right
room.
side, one
So
on
I
the left
suggested
side.
looking around
And
to find the phone
the
book.
vagus nerve
Calling
starts,
down to the
vagus
office,
nerve is the
just
longest
so
nerve
that
vagus nerves
the person
are the
could
longest
figure
nerves
out
in the
where he
body.
was.
They go from the brain.
Once he was able to
down
do
to the
that,
top of the colon.
he was able to contact
And
other
they are the
people
only
and
nerves
tell
that
them
send
how to find him so he could get back
impulses
where he
both
was
directions.
Now,
Other nerves
that
either
doesn't
go
happen
one
very
way,
often, but
or
it
they
can
send,
occur.
impulses out,
Another
or they
type
receive
of
sensory information in.
something that also is
Vagus
related
nerves
to
do
amnesia.
both.
Dissociative
And the vagus
amnesia is
nerves
called the
are,
fugue
are
state.
important for the
That is when a person kind of
parasympathetic
loses
nervous system.
sense of
Now,
who that the person is.
that's part of the
sort of like
who
the,
am
the
I?
various nervous system bodies that we have. We also have the
And
sympathetic
I've seen that
nervous
happen
system,
too,
which is
had somebody
responsible
call me
for I don't
having
know
our bodies
who I
respond
am.
when
Who
we're
am
in
I?
a fear situation or a
So
trauma situation.
There's
That's
discussion
the one that
with me
makes
telling
us
the person
ready to run,
who that person
or,
is and what to do in the
makes
situation
us about
because
to
of lack of lack of
have a
self
bowel
knowledge
movement or
So
whatever
that can occur too.
your fear response is.
Now,
The
the most
parasympathetic
profound
nervous system
version
is the one that helps
of
calm us
dissociative
down.
behavior is what's called
And so
dissociative identity disorder.
what the
And
vagus nerve does,
that occurs when
is
a person
they go
usually
down the
has
body
had
through the body,
multiple
and they
traumas,
have offshoots
usually
to
of various
send out
kinds,
information and
starting
receive
at a very,
information
very young age.
to help
I have
calm
worked
one
with
down,
some
one
clients
down
who've had
as
DID,
things
dissociative
become
identity disorder,
scary or whatever.
and they all
And
started having
one
many
interesting thing
traumas
about the vagus
before the age
nerves
of about
is
3.
that, as I said, they go
Some
down
of
to
the traumas they could
through the
remember
stomach.
initially, some of
And
them
we talk
came
about
back,
serotonin and how
through various,
relaxing it is, and it's
therapies.
important for mood
But
and all that.
what happens
Actually,
in those sorts of
we make
cases
more serotonin
is that during the
in
traumatic
our
situations,
stomachs,
the child
and,
will,
lower
in order to
intestines
protect,
than we actually
mentally
do in
protect
brain.
itself,
And so if you
will
think
break
about how the
off
vagus nerves
sort of
would be working,
a piece of it.
okay,
And that's called
when
an
we're trying
alter.
to calm down,
Alters
we start eating
will
comfort food.
take over
Comfort
parts of
food
the
helps,
identity of the person
and start
protect the
stir up
person,
maybe
basically.
some of the serotonin and serotonin
These
receptors
pieces
in
will
the
stay
stomach,
with
sending
messages
messages
back
back
up to the
throughout
brain
that
the
individual's
individual's
life,
calmer now.
unless
This is making me
the
feel
individual
better.
begins to realize that something
And
is going on.
Same thing with,
For example,
going from the brain
I once
down
worked with
somebody who didn't know she had
with
DID.
the parasympathetic nervous
She knew
system,
something
helps
weird was
calm
going on.
the breathing
She kept
down, the heart
finding,
rate down,
drinks
and
that just makes
coffee
make
drinks
somebody
and things
feel
like that she
hated,
just
in her
calm her.
refrigerator.
So,
But
she also was
the
telling friends that she was
vagus
pregnant.
nerve system
And
that's kind of
she
out
was
of
infertile.
whack. So,
And
there was something going
in
on,
order
and she
to
didn't realize
help
what was going
the
on.
person calm
And
down
so
and get the vagus
conversations
nerve
with
system to be
other
working
clinicians
better.
and
One
so
can
forth,
do several
we all
different
agreed
activities. One
that,
can stimulate the vagus
and given
nerve
her past
to help
traumatic
calm
history,
the body
that
down.
DID was probably
Now, I'm
the
going to give you
situation.
a couple of
And
really
I had her
easy
do a screening
options
test
to do.
for that.
First of all,
And she
one thing
scored really
people
high
use,
on it.
put your hands behind
When I
your head.
explained
You can do
what
this
it
lying
was,
down or
it
standing
made
up
a whole
or in
lot of
chair.
sense to her.
And what you need to do
shift your
and so
eyes.
she was
to one
beginning to
side.
go on her journey
I'm
to
going to the right
explore
side
and try to
and
reintegrate
count
herself.
to anywhere from
Other
40
people who have
to
DID,
90, and just
they don't want to
keep holding
integrate.
it.
They like
a
having
while.
different slices of
And
themselves
after you
do
finish
different
your
things
count,
throughout their lives.
center your eyes back, and
So,
then
for example, one
look
piece
the
might
other
be
direction, look
really
left.
good at
Or you can
working with
start
children.
left first
Another
and then do
one
right.
might be a really good cook. And so somebody like that may decide not to, but that process
integrate back.
will help.
But
the vagus nerve,
this
splintering off is
and
due to really
another thing you
intense,
can do
is
is you can
repetitive
do some
massaging. And I could
finger
go on for hours about
on
it,
this
but
side of your ear.
I'm trying to keep it short. So
Maybe in the
rub
future, if people
under
want to
your
hear
ear,
more,
top of
we
your
can talk
jaw,
about it more.
but
Little circles
in the
for a while.
population
Don't
as
push
a
hard.
whole,
Just do
1.5%
just
of rub people
all the
have
way
DID.
down.
Within various
throat.
clinical situations, that
On
percentage
top of your
goes up.
collarbone.
And especially in, say,
You do that
substance
for a couple
abuse,
minutes,
and that will
alcohol abuse
also
facilities,
help. It's up around
you calm
10%,
down,
if
and
not higher.
you stimulate the vagus
That's
nerve.
because
There are also,
in my experience, the
various
majority of
kinds
people who
tools,
are in
boxes,
such facilities
that
have had extremely
things like
traumatic
childhoods
have a little,
especially,
and they
electrical
have been using
impulse that vibrates
the
that
DID
area
helps them
of where
cope,
the nerve is,
and that can also help them
If
cope.
anybody has questions
And
about such
in the
tools,
future,
I
I
will be
have
discussing about
a lot of those
relationship
sorts of
of
things available
substance
that I
abuse
can share
to
with
trauma.
you in the future.
But that's
So,
for future.
That's
video.
all I have for today.
Now,
Next time
if
we'll talk
somebody
about
has
real
a
PTSD,
dissociative
and
identity problem, or any other
we'll start heading
dissociative
on talking about
problems,
generational
there are a
trauma,
bunch of other
which
things that
is
seem to go
real.
with it.
For
You know,
example,
the trauma of one's
eating
parents or
disorders, there might
grandparents
be a part
actually
of the person
can
and
filter
also
down
who
controls
from
eating
learning
or
and
not
from
eating.
there will be a lot of
Epigenetic changes
suicidal
that can
ideation
occur
and
in
attempts.
how
I'm checking my notes
person,
because I don't want to
forget,
brain.
there might be sleep
Actually
problems.
functions.
The person might have
So we'll talk about that next time. And relationship
if you
problems,
like
because
what I've been talking about, my content,
because
and
the types
you
of
find it
traumas that
useful,
occur,
or you
and
know others who might find it
neglect
useful,
and things like
please
that,
share it.
The person will have
Please
problems
give it a thumbs up
forming
and
really
subscribe if
strong
you wish to.
relationships. So thank you, and I'll see
The
you
personality
next time.
disorders,
Bye. As I talked before, can also go along with dissociative problems. There might be a lot of self-harm as well. And I will say, I've seen all of these things with the people with whom I've worked who have DID. Somatic symptoms. Somebody who has a set of somatic symptoms, they think they are sick or something will hurt, but there's nothing really wrong. And again, it's sort of the body remembering what happened. So the person might get a lot of stomach aches when in certain situations. And obviously, there's going to be a tendency towards anxiety. The person will always be, or some of the alters may be very uptight and tense about situations. And there will be a lot of depression because a lot of times people who are going through these sorts of problems don't understand why, and it just scares them and makes them sad. They feel different from other people. So, as I said, I've seen all of those in the people I've worked with who have identity disorder problems. Now, what I've been talking about in terms of trauma, I haven't even talked about post traumatic stress disorder. And I'm going to save that for the next one just because that's the one everybody hears about. And it overlays a lot of these other versions of trauma or trauma responses. So, as I always do, I try to give you something to use for relaxation. And so we're going to talk about the vagus nerve. Actually, there are two of them, one on the left side, right side, one on the left side. And the vagus nerve the vagus nerve is the longest nerve, or vagus nerves are the longest nerves in the body. They go from the brain down to the top of the colon. And they are the only nerves that send impulses both directions. Other nerves either go one way, or they send impulses out, or they receive sensory information in. Vagus nerves do both.
And the vagus nerves are important for what's called the parasympathetic nervous system. Now, that's part of uh, the various nervous system bodies that we have. We also have the sympathetic nervous system, which is responsible for having our bodies respond when we're in a fear situation or a trauma situation. It's the one that makes us ready to run or uh, makes us about to have a bowel movement or whatever your fear response is. The parasympathetic nervous system is the one that helps calm us down. And so, what the vagus nerves do is they, they go down through the body, and they have offshoots to send out information and receive information to help calm one down as uh, things become scary or whatever. And one interesting thing about the nerves is that, as I said, they go down in through the stomach, and we talk about serotonin and how relaxing it is, and it's important for mood and all that. Actually, we make more serotonin in our stomachs and lower intestines than we actually do in the brain. And so, if you think about how the vagus nerves would be working, okay, we're trying to calm down. We start eating comfort food. Comfort food helps uh, stir up maybe some of the serotonin and serotonin receptors in the stomach, sending messages back up to the brain that, oh, I'm calmer now. This is making me feel better. And the same thing with going from the brain downwards. Uh, with the parasympathetic nervous system, it helps calm the breathing down, the heart rate down, and just makes somebody feel uh, just calmer. So, but sometimes the vagus nerve system that's kind of out of whack, and in order to help a person calm down and get the vagus nerve system to be working better, one can do several different activities. One can stimulate the vagus nerve to help it calm the body down. Now, I'm going to give you a couple of really easy options to do. First of all, one thing you can do is put your hands behind your head, and you can do this lying down or standing up or in a chair. And what you need to do is shift your eyes to one side. I'm going to the right side and count to anywhere from 40 to 90, and just keep holding it for a while. And after you finish your count, center your eyes back and then look the other direction. Look left. Or you can start left first and then do right. But that process will help the vagus nerve um, be recalibrated and reset. Another thing you can do is you can do some massaging. You put one finger on this side of your ear, the other, and so rub under your ear, top of your jaw, in little circles for a while. Don't push hard, just do that, and then just rub all the way down your throat, down to the top of your collarbone. And you do that for a couple of minutes, and that will also help you calm down and re-stimulate the vagus nerve. There are also various kinds of tools, boxes that can do things like have a little uh, electrical impulse that vibrates that area of where the nerve is, and that can also work as well. If anybody has questions about such tools, I have a lot of those sorts of things available that I can share with you in the future. So that's all I have for today. Next time we'll talk about real PTSD, and uh, we'll start heading on talking about generational trauma, which is real. The trauma of one's parents or grandparents actually can filter down from learning and from epigenetic changes that can occur in how a person's brain actually functions. So we'll talk about that next time. And please, if you like what I've been talking about, my content, and you find it useful, or you know others who might find it useful, please share it. Please give it a thumbs up and subscribe if you wish to. So, thank you, and I'll see you next time. Bye.